Gene therapy is a technique that uses a gene to treat, prevent, or cure a disease or medical disorder. Often, gene therapy works by adding new copies of a gene that is broken or by replacing a defective or missing gene in a patient's cells with a healthy versions of that gene. Both inherited genetic diseases, such as hemophilia and sickle cell disease, and acquired disorders like leukemia, has been treated by gene therapy. Gene therapy is a direct way to treat the genetic conditions as well as other conditions. There are also other related approaches like gene editing. There are many different versions and approaches to gene therapy and gene editing. It also rests on understanding how genes work and how changes in genes can affect our health. Researchers all over the world are studying many different facets of gene therapy and gene editing.
I believe that gene therapy offers hope. Why I say so? Gene therapy provides an opportunity for affected individuals to lead a life that is normal. Some gene therapies may even offer the chance to survive because the genetic disorder is diagnosed as being terminal without an intervention.
You stated that gene therapy gives hope to people who are sick. Can you elaborate on the statistics you presented and so as the fact?
I can say that gene therapy offers hope because even with extensive screening in place for parents, there are numerous births that experience defects and genetic diseases. For instance, in the United States, one in every 33 babies experiences a birth defect of some sort. That's about 3% of all births. Birth defects are the leading cause of infant death in the US, accounting for 1 in 5 fatalities. With gene therapy, some of these defects could be corrected to reduce these fatalities.
Nature can readily respond to changes that occur, as we have seen with the increasing resistance to antibiotics. Gene therapy may be beneficial today, but in the future, further alterations to genetic profiles may trigger unexpected diseases. There is no certainty that gene therapy's future prospects could live up to its current potential for particular diseases to be treated. Without understanding it, we could be developing new diseases for future generations by altering genes.
So, are you saying that gene therapy is not improving at all? How can you say that we could be developing new diseases?
Yes, gene therapy is not yet improving since it is still an experimental treatment that replaces or inactivates disease causing germs through injection. Clinical trials and research indicate that gene therapy may worsen symptoms or make them last longer. Complications of certain gene therapies may include cancer, toxicity, and inflammation. So, with this, gene therapy is still an experimental process which could be harmful to humans' lives.
But even if you say that gene therapy is currently experimental, we can't deny the fact that gene therapy may treat more than just a disease. Gene therapy techniques could provide individuals suffering from infertility with the opportunity to start their own biological families. Using a modified gene therapy method called CRISPR, successful alterations to fertility in mice have occurred. This creates the potential of creating a similar effect in humans one day. Furthermore, according to GeneTherapyNet.com, gene therapy can treat the following diseases: monogenic disorders like sickle cell anemia, severe combined immunodeficiency, cystic fibrosis, hemophilia, multiple genes involved, and diseases that are dependent on environmental factors and lifestyles. For example, heart disease, cancer, diabetes, Alzheimer's disease, and infectious diseases such as HIV.
Let's say that gene therapy really treats diseases. With this new medical advancement, this could come up at high costly expense. If you are using Luxturna, a gene therapy clinic, to treat both eyes is a means to treat blindness. More than $1 million or 57 million peso may be the final bill. Even the affordable solutions begin at 11 million pesos per care. Can normal citizens afford this kind of treatment? No, because of its high cost.
Yes, you are correct. I accept that gene therapy is expensive, but let me tell you something. Insurers, governments, patients, and other payers always consider and decide how to support these expensive therapies, prompting talks regarding the cost benefit trade off. Given the high expense of gene therapy, people will undoubtedly find a way to obtain it. After all, how much is a human life worth? The key point here is that people have a choice. They can take the risk or lose their opportunity in life. To sum up, gene therapy is a powerful new technology that can change the way medicine is practiced in the future. The potential of gene therapy offers great hope for the cure and alleviation of suffering from genetic disorders that now plague numerous people. However, some disadvantages are considered by people who are not capable of paying for this kind of treatment because it's costly and by people who are not willing to take risks. Somehow, it is up to those who are willing to take the risk and trust the process of this treatment.